How you doing, guys? This is Kento, physical therapist, founder of Kamiyama Physical Therapy in New Jersey and New York. Welcome to my YouTube channel. We're going to first talk about the hip hinge today and the deadlift. What I was taught when I was a kid from my parents is that to use your knees when you pick up the kettlebell, not kettlebell, but anything heavy from the ground. Or don't use your back. So there was two ways that I was not to do, or one way really, to not bend your back when you pick something up. This is not a very good position because when you try to look and bring it up, you're going to use your erectors or back muscles, and there's a good chance of having a herniated disc, which we don't want. Another way is, well, that's how this next one is how I was taught with my father, is bending your knees to try to go down. This is great because you keep your back not flexed, but for people that don't have a very good strong quads or glutes, they tend to overly arch their back and they lift it up. The problem with this is because you're overly arching, you're always using your erector muscle or back muscles, and they could cause back spasms if you do too much, especially if you're like moving or doing a lot of weightlifting. And that's a lot of times I see problems as a clinician. So this is where the hip hinge or deadlift technique becomes very, very important. A deadlift techniques allow you to use your hamstrings and glutes, hamstrings and glutes, which much more. You want to use your glutes because it's one of the most powerful muscles in the body. So if you don't use that, you're going to lose a lot of power and you're going to put more pressure on areas that you don't like to. So if we go review about the hip hinge, what you're going to first do is you're going to obviously be as close as possible to the object. This is a kettlebell about 25 pounds. And what you're going to do is keeping that spine fairly neutral, not overly arched or not overly flexed, right in that middle. Okay? You're going to inhale, create that intra-abdominal pressure, and you're going to bend it at the hips. So bring your butt back as you slightly bend your knee. As you notice, with the squat, you bend your knee much more. With the hip hinge, you bend your hip much more. And as you bring your hip back, you should feel a nice stretch in your hamstring and glutes. Grab the kettlebell and push that floor away from you. Go down the same way, hip hinge down, bring the butt back. And as you notice, you should see my back fairly straight, not overly arched or overly flexed. So it stays neutral, and come back up. Hip hinge is a really good way to decrease low back pain and also knee issues at times as well. If you have any questions, feel free to comment. Visit our website at kamiyamapt.com. My name is Kento, and thank you for watching our channel.